pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. So we will begin our agenda with organizational issues. First, there is a follow-up to the reorganization meeting, which is that, which is that Bob indicated to me that there was some miscommunication over the duties around being vice chair. Now that has slightly changed because Lisa from the Township has agreed to do minutes for us. However, the vice chair still needs to be able to come to most, if not all, meetings in order to be able to chair in the event of my absence. And also because if there is ever a conflict on the Township schedule, they need to be able to take minutes in the events that Lisa's not here. So with that, he had indicated that he would be comfortable stepping aside as vice chair and allowing us to hold an election for a new vice chair. And with that, I will open the floor to nominations for vice chair. And I can share with the board that Andrew has indicated that he feels comfortable that he will be able to attend all of the meetings for this year. Any nominations?
I nominate Andrew.
And can I have a second?
Second.
All right, any other nominations? All right. So we'll take a vote on Andrew's appointment as vice chair. All those in favor? Aye.
Aye.
Any opposed? All right, I see none. So Andrew, congratulations. You're now vice chair by a vote of, how many of us are there? 6-0.
Can I just say one thing real
Yes.
quick? Thank you very much for your support, and I'm just looking forward to carrying on all the great work that you've done, Alex, and especially Dr. Simmons. So looking forward to the opportunity.
Very good. And then one other piece of follow-up to the reorganization meeting, which is that a majority of board members know that I have been in the process of applying to various grad schools. And unfortunately, I found out since the last meeting that I did not get into the one that is located in the Philadelphia area. I do already have a great scholarship offer from another school, but that does mean that come August, I am expecting to not be around anymore. I meant to make an announcement about that at the last meeting, but I forgot because most of the members of this board were already aware of that. So there is very likely to be another leadership election come August. But I will still be here through June, and I'm looking forward to spending the next 6 months getting as much done as we can. And with that, I would like to go into our next agenda item, which I have put on, which is recognition of health-related dates and milestones. If any board members have anything that comes up with this, I'm happy to put it on the agenda, or anyone who's aware of anything can just announce it. One that I did want to recognize is that this past February 3rd was National Women's Physicians Day. So Maggie and also Lisa Duman, who is not here, we celebrate they're bringing, some more diversity into the world of physicians. And, these days the gender balance, I think, is a little bit better, but I think there's still some work to do. So, that was February 3rd. I also next have to share a couple of updates from our solicitor. So everybody's aware on the board that we had a request for some documents within, I don't even remember when the original request was at this point, but just best practices, even if you don't necessarily have anything to turn in because you don't have anything that's relevant to the particular request that was made, please always reply to the solicitor, even if it's just to say, I don't have anything pertaining to this particular request. The next thing, also from some discussions I was having this.
Just
yes.
add to that. This is, for those of you who've worked in industry, these requests, this is a little bit like if you work for a company and they ask you for a drug test, you'll get fired if you don't take the drug test. nothing will happen to you except they'll offer you counseling if you pass positive on a drug test. The township indemnifies the board for those activities that are related to the board work. And it's always makes you a little nervous when there's lawyers involved and lawsuits. And if you don't have anything, if you don't keep records on your computer, if you deleted them before you knew there was a lawsuit, that is what it is. But anything that you have, if you were on the board during the Kratom discussions, if you have emails or text messages or other information, then it should be turned over to the solicitor's office to turn over to the complainant. Sorry.
Thank you, David. So the next thing I wanted to discuss, which also came up in some discussions I was having the solicitor, relates to all of our involvement with nonprofits. This a little bit came up because of the event that we did. Kiki and her family run a nonprofit, and Kiki had some questions for me, and I thought it was relevant to share with the rest of the board because in the healthcare space especially, most of us are actually probably more likely to be involved with nonprofit activities outside of the board than for-profit. And basically the feedback I got, and Kiki, because you were on this email chain, please feel free to chime in if you disagree, but pretty much there actually are not really that many restrictions. The only main restriction that he really pointed out was that we should not be doing any soliciting in our position on the board. There's nothing wrong with discussing anything that the various nonprofits that we're all involved with may be offering, especially if they're services that are open to the public. That's, actually part of what we're trying to do on this board is connect members of our community with resources that are available to them. So I just wanted to share that with everyone because I thought it was relevant to the board. Kiki, did you have anything?
I just wanted to add that I'm very mindful of the many hats I wear and plates I spin, and to make sure I'm wearing the right hat at the right time and spinning the right place at the right place. So
Yeah, it came up because of the event that we did, but again, most of us have, I think, some involvement with, my last job, I had a client that was a nonprofit. I know various members of this board work for Mainline Health and Jefferson and Penn, which are all nonprofits. So I just kind of wanted to give everybody that clarification. Does anybody have any questions related to that?
Did the solicitor have any issue with the program?
No, there was no issue. Kiki actually sort of brought it up proactively in a conversation with me, and I thought actually that's probably a question that a lot of people might have is, what is the line in terms of what I should or should not be saying, in my capacity as a member of the Board of Health. And like I said, basically the guidance that he gave was don't do any active soliciting. So, you can't ask anybody, you can't sit here and ask anybody to donate to your nonprofit or, from this chair, but beyond that, discussing sort of the services and the work that you do, there's absolutely, no issues there. And then the other note that I got from the solicitor, so I'm just going to read exactly what he wrote about this. As to meetings, there has to be a quorum for the meeting to be valid. If there is no quorum, I would recommend not convening. There have been some meetings where less than a quorum appeared and members met and discussed agenda items. However, these are not valid meetings, and I would not recommend this occurring. During COVID, some of the sunshine meeting rules were relaxed by the state. Radnor's Home Rule Charter requires in-person commissioner meetings, but it doesn't address lower boards and commissions meeting attendance. If BOH had interest in such hybrid meetings in order to have a quorum, I recommend establishing some guidelines. So basically, the reason I'm bringing that up is because we have done that in the past of having meetings where we didn't have a quorum and just basically not voting on the minutes. It sounds like from this email from the solicitor that we should probably stay away from doing that in the future. However, the good news is there is no restriction on us having any hybrid meetings. Based on what I assume to be the preferences of the rest of the board, I think that it would probably be good to go ahead and just establish all of our meetings as hybrid moving forward. It seems like that would make it much more conducive to getting better attendance and also kind of guard against weather issues. Does anybody on the board have a different opinion on that? It seems to me that that would kind of facilitate more people being able to participate.
Well, so I kind of have a beef with the solicitor here. And that beef is that in email chains, we're not supposed to reply to all, because if we reply to all, then it becomes a meeting and therefore is subject to sunshine laws. If we don't reply to all and confine our discussions by email to small group discussions, that's not considered to be in abeyance of the sunshine laws. So I don't understand why a meeting of the board isn't the same. We're all in the room, we can have discussions, we're not obligated because we're not doing business of the board, and so his opinion feels a little bit harsh and restrictive, and I'm not sure what the harm is to the public if we do not vote on business of having discussions when we can't bring a quorum together.
Well, so I'm just going to, again, go back to the exact language that was used. He doesn't say that we can't do it. He says, I would not recommend this occurring.
We didn't recommend it either.
I-
But we didn't have
I
the,
know,
we didn't have the folks, and we had people in the room, and I think we should invite him here, because I'd like to ask him what the problem is. It kind of makes me a little angry.
Like I said, I'm just reading what the solicitor's words are.
Okay.
I think we should try and stay within the advice that we're getting from, the solicitor as much as we can. And again, so back to the point about hybrid meetings, is there any kind of difference of opinion from the board on that? Because that's just something I kind of want to get cleared up, but I'm happy to just take a seat. Because I'm happy to kind of facilitate that happening unless there's any major objection from the board, but it seems to me that would facilitate more participation.
I definitely agree with that, and I think that a hybrid option is a good idea. I think it seems like it's the best idea for it to enable us to have consistency on the time of the month that we're going to meet.
And that is our next agenda items
So,
to talk about that.
I think there's benefits to meeting in public for a public forum like this, but I think where the meeting schedule has to change because of things that we can't control, then I think that would be a good time to use a hybrid option so that we can continue to keep to a schedule and not have the confusion and because I think it also causes it's sort of like we change the meeting time, it messes with the schedule of some of the people that are trying to attend. So I feel like we could, anyway, I feel like we should use the hybrid option to have the meetings when we would normally have them, if we can. I don't know if that's something that works, but that's my input.
And should we table the question until we can have the solicitor here to ask him questions to walk us through it, or do we all have enough
Well, I mean, so
information?
having the hybrid meetings just means that we have the option. Everybody can still show up if they want to. Frankly, the other thing it would do is if we just need to get to a quorum and we have 4 people that are here and we have one person who can hop on the phone, but they can't really participate beyond hopping on the phone, that would at least get us to a quorum. So there's nothing that says that, we have to then all stay home if we have the hybrid meeting option. And frankly, I would encourage everyone to come in unless they're sick or there's a weather, some reason they really can't get here. It would be expanding the available options for participation.
Question about the option for a hybrid meeting, I guess that does not change the fact that there are certain days we can't meet because of a holiday. Is that true?
I believe that's correct, especially when it's a federal holiday where basically the township building is closed and the staff has the day off. It would not really impact that. We wouldn't be able to have a hybrid meeting on Martin Luther King Day just because we were hybrid, not in person. other board comment on that particular issue? Should we move on to discussing? So I sent out, in terms of possible meeting date time changes. So this has been an ongoing thing for our board, is that there has been desire for consistency in terms of the meeting dates and times. I have looked at the township calendar. Any Monday that we change to, we're going to run into the same issue of holidays. Tuesdays, we would run into the same issue because since commissioners meet on Mondays, anytime they get bumped on a Monday, they go to a Tuesday, and then somebody
We
could do-
don't usually, we usually go to a different Monday.
Okay.
The only time is the very first organizational meeting, if it gets messed up by New Year's.
Right. And
We
then,
would meet on the Tuesday, because
and-
no other board can do their organizational meetings until we do ours.
right. And the other issue with Tuesdays is that twice a year, it creates an issue with Election Day as well. So really, and then also for the later Tuesdays in the month, there are other boards that have meetings. So in terms of, and then Fridays would require, township staff to stay late on a Friday, which I'm not going to be asking township staff to do, and I wouldn't want to ask anyone to do. So where that leaves us is that there are 2 available days on the township calendar where other boards do not have meetings. Those are the first Thursday of the month or the third Wednesday of the month. So I did send that out to the board. I don't know if anybody has looked at their own calendars to figure that out. We do also have 3 board members who are not here, so probably we'll want to get their opinions as well. But I did at least want to kind of announce in public that those are the dates that we're looking at. Does anybody have an opinion sort of off the bat about their own calendar and what might work for them?
Yeah, I hate the middle of the week.
Okay.
And I would also add that I don't care what day of the week you put it on. There are going to be changes. There are going to be snow days. There are going to be scheduling issues. There are going to be epidemics of respiratory diseases. And I just find if you pin a day and you stick with that day and you ask people to comply, that to me, in my experience, has been the best way to run things. I think that you can spin around and chase your tail and try and find a day when everybody can come all the time. Bonne chance.
Any other board comment on that particular item? All right, so I will reach out to the other board members, but it sounds like there's maybe not necessarily that much appetite for changing to either the first Wednesday or the first Thursday or the third Wednesday. So it sounds like for now we will be keeping it on the third Monday, but with the hybrid option being added. And with that, we're going to move into an item that I put on, which was discussion and potential approval of I'm going to take 1 minute because Maggie, you have to leave at 6, right? So I'm going to go ahead and move up the Board of Commissioner liaison report to right now, and then we will resume the agenda at that point.
Yeah, sorry, there's a meeting upstairs at 6. So I'll be quick. I just have a couple of things to share. The first is last Friday, there was a rabid raccoon at Skunk Hollow, and it was attacked by an off-leash dog. They did capture the animal. It was positive for rabies. The off-leash dog was vaccinated and is under quarantine, or whatever the regulations are. Along a similar vein, at the Board of Commissioners meeting on 2/12, we introduced a Parks and Recreation ordinance that would, as of right now, dogs may be off-leash. Everybody's going to groan when they hear that. And Skunk Hollow, and in the parks in Radnor Township that are allowed, where dogs are allowed. But they must remain under control. We had an appeal from some people who wanted to use the Skunk Hollow Trail and felt that the dogs were knocking them over, getting them muddy, terrifying children, all kinds of complaints. And Parks and Recreation met and did a very thoughtful meeting and made a very thoughtful recommendation that from 5 p.m. till dusk, which is the close of the park, dogs must be on leash at the Skunk Hollow Park. And otherwise, it will remain as it is now. They have to be under control, but need not be on leash. So that's pretty much all that's new and public health related. As far as public safety, I have one little thing to say, is the King of Prussia Road Bridge Strike Deterrent System is up. Already been hit twice. Neither truck that hit it hit the bridge. So we're batting 1,000 right now, and it will be on the news tomorrow. So.
All right. There's one other thing that I wanted to do while Maggie was still here, and I was sort of waiting to try to see if, because Lisa Duman said that she might come a little bit later, but I think we're not necessarily going to get Lisa and Maggie to overlap if she does show up. David, unfortunately for you, I am one of those people who, despite not liking surprises myself, does enjoy surprising other people. So we have something for the township, from the township for you. Because of your service as chair of the Board of Health over a number of years, and through some very trying times, we had a pandemic that lasted longer than anybody initially could have anticipated it would last. We lost our health officer to the county because the county went ahead and established a health department, and we had that transition going on. I know Lisa wanted to be here to say something as well, but unfortunately, I think timing-wise, we may not get there. But if she does show up later tonight, we'll invite her to say a few words as well. But so this is in recognition of your dedicated service to the public health, safety, and welfare of the Radnor Township community, serving as chairperson of the Radnor Township Board of Health in 2021, 2022, and 2023. Please know that the citizens, commissioners, and staff of Radnor Township deeply appreciate and thank you for your service.
Well,
Your microphone.
I'm stunned, and I deeply appreciate it. Thank you. It has been an honor to serve and a privilege to serve, and that's just not mouthing the words. I mean, you run a career for a really long time, and you stop working, and you look for opportunities for purpose, and this has been an opportunity for purpose for me, and I thank you all for taking the time to recognize that. It's really, 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 really appreciated. Thank you.
And we'll have to take pictures of you with the plaque at the end of the meeting. All right, so I think with that, we can jump back to where we were on the agenda. So I had put an item on here for discussion and potential approval of a social media intern position. So to give some of the members a little bit of background on this, we had a lot of success with our last special event that we did. As of this morning when I checked, it had 768 views on YouTube, which is pretty incredible. Yes. For context, our regular meetings tend to get about 70 views. I had been in discussions with Hyun Kim, who's one of our Radnor High School students, who had applied for the Board of Health internship for a couple of years in a row, and unfortunately got a little bit caught in the change about the way that we were doing the selection. In terms of in prior years, we had sort of favored students who pitched their own ideas, but then this year we're more focused around kind of the ideas that we were pitching to the students. And I think there was agreement I reached out to Lisa, and Julie, who had also reviewed the student intern applications from this year with me, that Hyun was very well qualified, but unfortunately we just didn't think that any of us would have really been able to be of that much help with her project. So in my discussions with her, I mentioned this thing about, that it would be great if we had some way of doing some more event promotion for for these events that we're having now, and Hayun had been kind of looking for ways to still be involved with the Board of Health. So she talked to me about whether we might be able to use an intern to help out with some social media things. I, am on no social media other than LinkedIn. I don't know how comfortable everybody else is with social media. But I asked her if she could, come up with some ideas about some ways to maybe be helpful on social media. So Hayun, do you want to step up to the microphone and talk about kind of what you came up with?
So here are the things that I would do if so these are the things that I would do if I become a social media intern. So I would post highlights of the Board of Health meetings by participating in every meeting. And also I would upload graphs and photos mentioned in the meeting, and I would talk about what is going on in each graph or the photo. And I would also promote events by doing community surveys through the social media platform, which can be done easily through that platform. And also I can communicate with the members of the board and promote anything that is necessary after communicating. So these are the things that I would do as a social media intern.
And sorry, just one other point of clarification. So the idea with this would be that we would be having Hayun do this on sort of a trial basis because of the fact that we're in the middle of a school year and we've already reviewed her resume a few different times, and that if moving forward we find this to be useful, then in subsequent years we would go through sort of the normal application process that we've been doing with other student interns. Does anybody have either any questions for Hayun or questions for me? Or
Hayun,
Go ahead.
sorry.
Go ahead.
Hayun, I wanted to ask, what are the platforms that you would be posting things on? I know RTSD has an Instagram page. Would it be tell us about what platforms you would be using?
Okay, I'm very used to using social media platform of Instagram, so I think I'll mostly use Instagram to promote things. Yeah.
And would that be through RTSD?
I would create
Or
a new.
you would create one. Okay.
Yeah, a new account of the Board of Health.
Okay, great.
Yeah.
Thanks.
So I'm not trying to give you scope creep or change your thinking, but when I was preparing the brief remarks that Alex has asked me to continue to do on the transmissible diseases, there were several charts on a website, on the CDC actually it was the Pennsylvania Department of Health website, that I would love to have just been able to flash them up for the meeting without going through having to create a file out of them. And would you consider that under the purview of the things that you're talking about here to
Yes.
be able to make that? If I said, okay, we need these, I sent you an email or a text and gave you the specifications, you'd be able to bring those into this meeting?
Yes, of course. Yes.
Cool. The boomer talking.
I think this is a great idea. I think one of the strongest things that our board does is work with students and help them to develop their talents and their knowledge and help us to pass that on to the community. And the reason that one of the reasons I'm saying that now is I see the opportunity once we get our social media presence up and running to use it as an educational piece, not just for things like the meeting proceedings and whatnot, but other kinds of topics that we want as the board to make sure that the citizens of Radnor Township are aware of. I think the infectious disease situation is one example, but there may be others as things come along through the year, and I think that would be a wonderful opportunity for everyone, actually, literally. For everybody, I think that would be a great thing if we can develop that.
Would Hayun be able to post a link to the Board of Health page on RTSD or in the Radnor page? just so that it's accessible in case, people don't know what to look.
Yes, I can upload the link, yes, in the page, yeah.
One other point of clarification I wanted to make, because since I have done feedback with some of the students who didn't get selected over the years, I know some of the other board members who have looked at resumes may not have connected names with faces, but if anybody remembers the resume of the young lady who has a medical device patented in South Korea, this is that applicant, so so certainly very well qualified. With that, I don't know that we need to take a formal vote on this. Is everybody okay with bringing Hayun on as our social media intern for this year, and then starting with the subsequent school year, if we like how things are going, we'll do an application process? All right. So with that, Hayun, I guess if you want to go ahead and take a seat over there next to Chloe, who I think you already know. I think we just might move Maggie's name tag for now, and then we'll look forward to seeing you every month, and you and I will get to work after the meeting with some of the stuff. All right?
Okay, thank you.
All right. The last thing I wanted to bring up is I put on a discussion of our relationship with Radnor Township Police Department. Basically, the reason I put this on here is after we had the event last time, I got pretty quickly some feedback from the police chief that they were interested in doing a couple of other events. I'll address those a little bit later in the meeting, but so actually I guess we can just discuss that later in the meeting. Does anybody have anything else they wanted to bring up under organizational issues? All right, so let's move on to review and approval of the minutes. Does anybody have any notes about the minutes from the last meeting? Can I get a motion to approve? Can I have a second? All right, all in favor? Aye. Motion passes 6-0. Minutes are approved. With that, we'll go back to the reports, and we'll take a report from our school board liaison. Ms. Kevgis?
Good evening, everyone. It's nice to see all of you. It was a busy month for the district. I'm going to go quickly through what we were seeing health-wise at the different schools, and then just bring to your attention some programs that we have in place to help with, the health of students and the community. Ithan Elementary has been seeing some sinus and upper respiratory infections, some GI bugs, and a little bit of COVID. Radnor Elementary, lots of fevers with headache, sore throat, couple cases of strep, COVID, the flu, and pink eye. Radnor High School, COVID, upper respiratory, stomach issues, flu, pink eye, so very similar. Wes, same as Res, or Wayne Elementary with pink eye, still seeing some lice and upper respiratory infections. And then finally, the middle school, sinus infections, upper respiratory infections, and some COVID. Radnor Middle School on January 23rd held their annual Speak Up. This is something that the high school does as well, and presents an opportunity for students, parents, and teachers, as well as staff members, to share open and honest conversations. Many times those, focus on mental health, amongst other things. Mini-thon is coming up for the middle school. As you well know, that's a fundraiser for childhood cancer. Penn State just raised an extra $2 million this year, I think it was, close to $17 million, right? So that was a wonderful event. Dr. Ken Ginsberg is actually coming in February 28th from 7 to 8:30 at the middle school auditorium. He is a professor of pediatrics at CHOP and will speak about the importance of parents, the importance of parents in the lives of adolescents, and the best way to prepare your child to move on to post-secondary. Finally, the DCIU parenting event, Executive Functioning Skills, will be held on Thursday, was on Thursday, February 15th, and this was an effort to get out the message on how to teach our children to manage their time, space, and materials, which is always a struggle, especially as our middle school students move up to high school. Those study skills are so crucial for them to really get in place. And I think that's it for the month. Thank you.
Does anybody else have anything under the category of school board or Radnor schools? All right, so we'll move on to updates from the county. We had 12 inspections during the month of January for this year. Of particular note, Samantha Cooper, who had been our regular sanitarian, has been promoted to supervisor, so she's now going to be supervising inspectors. Inspections are going to be done by multiple county inspectors from now on sort of a rotating basis, so we're not going to have one designated inspector every more, but we keep getting people in Radnor that keep getting promoted on up to leadership at the county, so we're very happy for Samantha. I think that's she was doing an excellent job for us, so I think that's an excellent choice on the county's part. There was a technology issue that prevented the full reports from Margaret Quo's, Ithan Elementary, and Cabrini from being uploaded to the county website. I included copies of the full report on the report that I prepared by just getting a copy from the county. 333 Belrose had a pipe leak, and they were allowed to reopen following an inspection there. There was one follow-up inspection this month that was at Cabrini. No further follow-up will be required. We had one inspection from January that did result in the need for a follow-up inspection. That was Margaret Quo's. Their follow-up inspection is scheduled for the 26th of this month. We had 5 establishments that had issues with labels, either dates or the name of the food or the name of a particular chemical that was not on a bottle. That's just something that they need to be aware of. They should be naming and dating anything. We had one establishment, and I've been seeing this sort of about once a month, so that's why I'm noting it, even though it's only one, that was caught using a domestic microwave. There are certain specifications that are needed for food service establishments in terms of the equipment they use, so they can't just get a regular domestic microwave. And then we had 2 establishments that had perfect inspections where 0 violations were noted. One was the 7-Eleven, and then the other was our very own Radnor Elementary School. That is what I had in terms of the food inspections. Some other updates from the county. There's a little bit more than usual just because they reset some things with their calendar for the new year. So a number of free clinics going on at both the Chester and Yeadon office. The Chester office is at 151 West 5th Street in Chester. The Yeadon office is at 125 Chester Ave in Yeadon. STD, STI, and HIV clinics are 9 to 3 weekdays at the Chester office and 9 to 2 Mondays at the Yeadon office. Appointments are preferred but not required. Immunization clinics are 10 to 2 alternating Mondays at the Chester office. Appointments are required for that. And then there is a Vaccines for Children program at the Yeadon office on alternating Tuesdays. That is 10 to 3. Again, appointments are required. And then in honor of Black History Month, they are doing on Monday the 26th from 10 to 2 at the Yeadon office a free blood pressure screening event that is walk-ins only. It's an issue that is not limited to the African American community, but certainly the African American community sees elevated rates of some blood pressure issues, so it's nice that they're doing that. And then I also wanted to announce that the county I guess they're doing this as an annual thing for Black History Month, which we're in right now. They selected, and I guess are going to select every year, a public health pioneer from the county. This year they selected Coach Elmore Roy Hunter. He's been a coach and PE teacher in the area for decades. He's leading a project to help Penn Woods students explore quality of food in their local grocery stores, and introduced the 4-H program to Chester and Philadelphia youth, as well as introducing environmental science to students at Penn State, Abington, and Brandywine. Does anybody have anything else under the county? All right. So with that, we will move on to presentations and programs. We will start with our student internship program. Very briefly, I will mention that Lisa Duman and Finn were both unable to attend tonight, but they did tell me that they are continuing to make some progress on their project. And with that, I guess we'll go to Lisa and Chloe.
So I'm going to let Chloe talk in just a second, but just to give an update, we've had a few meetings, and Chloe's done a great job revising her survey and getting everything into the appropriate channels at the high school. And so then I'll let Chloe do an update on where things are at in the timeline.
I just want to thank Dr. Bannister, Dr. Kohler, and Mrs. Kevgis for all their help. They really helped with finalizing my survey. So I'd like to just start with restating the rationale of my research, and this is also what I said to Dr. Mack, the high school principal. So my study, the relationship between sleep hygiene and social emotional well-being amongst adolescents, seeks to further expand the existing RTSD initiatives, the student wellness study, and the student sleep and healthy school schedules. So the RHS sleep study shows that a high percentage of RHS students have poor sleep habits, as well as a higher rate of anxiety and depression. However, the link between these two variables have not yet been assessed, and my study intends to examine whether there may be a relationship between these variables and the goal of making recommendations for appropriate sleep hygiene. And I sent Dr. Mack that rationale as well as the survey link, and he looked it over, and he sent it to the school board, and they will look it over March 5th to just check for any issues. And then Dr. Mack also said it will be board approved on March 19th at the regular business meeting, and he said once it is approved, hopefully I will then shortly thereafter be able to administer the survey. And I'd like to just share a little bit explanation of my survey. So there's 2 sections to the survey, the social emotional health and sleep hygiene sections. They both ask the student, how often have you been bothered by the following over the past 2 weeks? And one question is just from the sleep section is feeling anxious or nervous or on edge. And then from the sleep section, it just asks, I still feel sleepy even after I wake up, and the students will answer on the degree of at no time, some of the time, most of the time, and all the time. And so each of those questions will have a score of 0, 1, 2, 3, respectively. And so my plan is to take the scores from each responses section and see if if a student or response scores highly on both sections, that will tell me that there is a correlation between poor sleep hygiene and the quality of one's social and emotional health. Thank you.
Thank you, Chloe. Does anybody have any questions for Chloe or Lisa? All right. With that, we will move on to follow-up to the opioid presentation. So we had 31 people who came out through snow and ice and some, not so nice weather to participate in person. I don't know how many necessarily watched live either on YouTube or the Township's cable streaming, but we had 768 views online after the fact, which makes it the 9th most viewed video out of 1,900 videos on the Township's YouTube page. So we're very glad that so many people tuned in, and thank you to everybody who liked and shared it online to get more people to see it, because that is potentially life-saving information that we want as many people as possible to see. I definitely want to thank Maggie's no longer here, but I'm sure she'll watch the rest of the meeting later. Thanks to Maggie for helping us get that event set up. Thank you to the Township staff, especially Ian and Peggy, for all of the work they did to get that set up. Representative Borowski and also Marie Carbonara from the county for coming out to support the event. Savage Sisters for putting on the event, and also Chief Flanagan for coming out and presenting with Savage Sisters. We had some wonderful community members that came out. In particular, I wanted to thank Heather King, who came out and shared her story at the event, and then, of course, also the Kiki and the rest of the Carianis family for sharing their family story with us. Kiki, did you have anything you wanted to say about the event?
I thought it was a wonderful turnout, as you said, despite awful weather, and I think that it was extremely informative. I've gotten nothing but positive feedback to that effect, so I'm happy to hear about that and hope to be able to do other work with Chief Flanagan. Look forward to doing that. He was very happy with the outcome as well.
Yes. And also, as long as we're on that topic, again, thanks to all of the nurses from Radnor who came out and spoke to us at the meeting before that, and Amy Roseland as well, our awesome health department chair at Radnor High School and my former health teacher as well.
I'm sorry, I meant to share with you as well that I did get feedback from the nurses, and that was something that they were going to go ahead and show to the nurse staff, that, you know, the YouTube of our presentation. So that was remarkable to hear as well.
Yeah, that's great. And then something you and I also talked about that I wanted to bring up with Panayota, because one of the things that Ms. Roseland shared with us when she came was that they are doing Narcan training in the health classes. And we know that, so that's great that the students are getting it, but probably most of them are going home to two parents who do not necessarily have that training. If they're the school or the health teachers or health department at Radnor would be willing to do any kind of a thing where the students could get some kind of extra credit or something like that if they take a video showing their parents how to do it or anything like that, that would like triple the amount of people who are getting that training. So I just wanted to kind of throw that out there because we know that our students are getting a great education there, and if they can share that with their parents, that'll increase the number of people that have this information.
You know, I always love involving students, but I'm thinking about the discussion that we just had with our social media intern. Perhaps that's something the Board of Health could do as a demonstration, and we could put links on our page to that so that many people could see that, and making sure that perhaps Ms. Carianis as a nurse, you know, shows us the proper way to do it so that it's a medical professional.
All right, Hayun, we're giving you homework already. All right, so the next thing on the agenda is the oral health program. Bob is not here. I don't know, Panayota, were you and he able to get connected offline? Because I know I gave him your contact information.
We did not.
Okay. All right. Well, we'll keep that on the agenda for the next meeting. The next one that I wanted to share is that the third week in March is National LGBTQ Health Awareness Month. And on March 18th, which is our meeting, but we're going to do it after the meeting as we did last time, we're going to have a panel of experts from Mainline Health who are going to talk about some issues that the LGBTQ community should be aware of in terms of healthcare. So we have 3 panelists coming from Mainline Health, and that'll be at 6:30 on March 18th after our meeting. So definitely looking forward to that. I don't have any firm dates on this, but I did get 2 requests from Radnor Township Police Department after our last meeting, which was they wanted to do one event that was Stop the Bleed, Narcan, and CPR, and then possibly another event that would revolve around introducing the community support unit. So we're working on details and timing and things like that for that event. And then I also wanted to just make sure that the board is aware that, you know, at any time, if anybody has any presentations that they want to try to organize, either a short form presentation that could be done during our meeting or a longer form presentation that would happen not during our meeting. I'm happy to put those on the agenda and get them advertised at any time. My recommendation based on what Kiki and I did with the last one is I think probably you want to start at least 60 days in advance, and probably 90 is even better, because I think we both wished that we'd started even a little earlier than we did. So,
And that speaks to the interest of the community as well, particularly since it fell right, this came directly after holiday season, and that kind of put us in a bind as well with getting the information out there and communication. So
yeah.
that was,
So the sooner you can start planning, the better, but I'm definitely happy to, as long as it doesn't create a conflict with the township calendar, work with, anybody or any medical professionals that anybody else knows to make something happen. And the nice thing about this program is that since it's new, we can format it any way we want to do it. So definitely open to creativity on that. And with that, we'll go to David, who has graciously agreed to stay on the beat with community infectious disease.
Thank you, and thank you for asking me to do this, Alex. The three major infectious diseases that we followed regularly, RSV has essentially come back to background, sporadic, after the seasonal eruption that occurred right around the Thanksgiving, just before. That's a typical year. COVID has become pretty hard to follow, but if you follow ED visits and percent positivity in ED visits and hospital admissions, and if you look at it at national, state, and local level, it appears that the most recent peak is dissipating. It has had the shape of the Omicron peak, not of the original or the Delta peak. There are still people hospitalized. There are still people dying. But it certainly appears that the endemicization of the family of viruses that we call COVID-19 has produced highly infectious but a lot less virulent strains of the infection. With that, I strongly still recommend that those individuals who are at risk of severe disease consider inoculations. That Paxlovid is over time proving to be a safe and effective treatment if you are at risk of severe disease and do have COVID, and that for those who need to protect themselves, well-fitted N95 masks in public are helpful. Influenza, on the other hand, is probably not completely peaked yet, and there are increases in visits, increases in positivity of testing. There have been 270 Pennsylvania deaths from influenza this year. The predominant strain is AH1N1, which is covered by this year's vaccine, but some increase in B strains, and I don't have any greater specificity on that. But protect yourself, remembering that influenza, if you need to protect yourself, masks for influenza are actually more capable of protecting yourself as opposed to protecting others. Masks always help to protect others from you. Not going to work when you're coughing, sneezing, or spreading viruses is a pretty darn good idea, or go to school. And there are drugs which shorten the duration and decrease the probability of severe disease for influenza as well. So, keeping it short, that's my report.
Does anybody have anything else under the topic of community infectious disease?
I was going to talk about the rabies case, by the way, but Maggie took that
But
out.
Maggie beat you to
And
it,
there
okay.
there was no update on the measles outbreak. The latest data we covered off in our
Okay. With that, I did not have anything under old business. Under new business, I did get a request from Commissioner Riley, and I don't know if anybody had time to read the article or not. Looking at the time, we may also just kind of come back to this at the next meeting. Basically, there was a request from Commissioner Riley to discuss this. There's been some concern in the community over water quality and some different contaminants that are in the water, especially around the idea that basically the federal limits for certain contaminants are sort of woefully insufficient related to, what science would say are acceptable amounts of certain of these chemicals. I'm not an expert on water quality, other than I do know that filter-wise, the best kind of filter you can get is a reverse osmosis filter. I did ask, actually, Bob, who unfortunately is not here tonight, if he could look into whether there's any research about filters taking out too much fluoride, because funny enough, I had just bought myself a water filter, and of all the things it takes out, that's one thing that you wouldn't necessarily want taken out if there is fluoride in the water. But I don't know if anybody else had any reactions to this, or if this is something that maybe we want to all kind of take a look at and possibly discuss again at the next meeting.
I think water quality is like climate change and air quality, and it's a critically important issue. But what I'm not certain of is the role of the Radnor Township Board of Health related to water quality. Did Commissioner Riley want to come and talk to us?
I think initially it was more about kind of just getting some discussion about it going. I get, I don't really have any expertise on certain contaminants and, carcinogens versus, chemically poisonous contaminants or anything like that. I do know filtration-wise, because I just know that reverse osmosis filters are the ones that get the most things out. So for anybody who's looking for their personal home protection, a reverse osmosis filter is the best thing you can do for, for yourself in your own kitchen. As far as, looking at what the township does, I don't know exactly what our role could be. It might be something to bring up again at a meeting when Maggie's still here. We do have a home rule charter in Radnor, so we have a little bit more leeway on what we can do than what, townships that don't have that can do. But I think the main thing was he wanted to at least get some public discussion about the issue started.
I heartily endorse that. I'm just not sure how to start and how to get traction. We use a two-phase reverse osmosis and activated charcoal, and I'll tell you one thing, water just tastes a whole heck of a lot better, which is no taste.
All right, so I think with that, we will open the floor up to public comment. Is there any member of the public that wishes to address the board?
Sarah Pilling, 29 Garrett Avenue. I don't see how anyone cannot be at least reading or noticing or bypassing the news about climate change. We've now reached the level that we were not supposed to reach, up 1.5%, and it's blowing past it. It was interesting to read this last week in the New York Times about the East Coast is actually sinking. And I know my son in Maine is seeing flooding like he wouldn't believe, and his town council does not want to believe. It's happening in the Jersey Shore, where they're having sunny days of flooding, which means more water, standing water, more insects. Dengue fever is beginning to show up in the South, and having experienced it twice. First, I thought I might die, and then I was afraid I might not die. So the infectious diseases from insects is going to increase. And I'll say it again, I wish the township would just make some plans. They don't have to be instituted if we don't have terrible heat waves this next summer, but at least we should not be stuck with our thumb in the mouth when we have 6, 7, 10, 20 days of over 90-degree heat. And it's the nighttime temperature that's the most telling. So I've said it to the commissioners, I've said it to you. We have churches, we have schools, we have community centers who could be open in the evenings for the residents, because not everybody can afford or wants to just turn up the air conditioning so they're so cold they're wearing sweaters. And I think it's something we should attend to. Little children and seniors and those who are immunocompromised are the most vulnerable to heat deaths, and they are increasing worldwide. I would not want to live in an area where it was 122 every day. Fortunately, we are not going to have to, but I think we must make plans. Thank you.
Thank you for your comment. Is there any other public comment? All right. With that, I will take a motion to adjourn. Second? All right. All in favor? Aye. Meeting is adjourned.